After the death of Elijah McClain in 2019, the use of ketamine became controversial. A panel of medical professionals didn't investigate a single case, but conducted a full review of the program that allows paramedics to administer the sedative.
It's a medication that can really help us get somebody from in the field to a hospital where we can provide more definitive care.
Dr. Janetta Iwaniki is a medical toxicologist and was a member of this committee. In the 126-page report, the panel concluded ketamine is a safe drug if used properly and monitored closely.
That is making sure it's being given to the right patients and being given with the right monitoring.
The report recommends first responders shouldn't use the sedative for excited delirium, a diagnosis that's been scrutinized for the potential of bias.
That risk prevents safe assessment, treatment, and transport. And it's a patient where we have tried efforts at verbal de-escalation, and those efforts have failed.
The panel also advocated for a change in oversight. They suggest that licensing for ambulance agencies should happen at the state rather than county level.
When something happens, the state can look at the practice of the individual EMTs and paramedics. But there's limited ability to look at the agency.
Scott Scholes is the president of the EMS Association of Colorado. He supported the panel's recommendations. If the state lifts the suspension on the use of ketamine in emergency settings, he hopes this review is seriously considered.
We'll see how many want to continue with with waivers for this in the future.
We hope that the data and the research we've provided them will be helpful.
The panel also made recommendations for dosing, basing it on a patient's body stature rather than weight. When Elijah McClain was injected with ketamine, medics overestimated his weight by nearly 60 pounds. It also suggested the state health department analyze whether there is a disproportionate use of ketamine for communities of color. Now, the state health department must now decide how they will implement these recommendations, Kim.
So it seems like it's very specific, depending on the circumstances and, of course, the body structure of the person.
Yeah, they didn't look, again, at a specific case. They wanted to look at the system as a whole to see how we should use ketamine in the future. Now we're going to see how CDPHE moves forward.
All right. Thank you, Kelly.